Every single morning across America, seniors with back pain pour themselves a cup of coffee, and then they do nothing else with that cup except drink it. But what if that same morning cup of coffee could become one of the most powerful natural tools for back pain relief available to you, simply by adding 1/4 teaspoon of a specific ancient powder to it before you drink it? A powder made from the root of a plant that has been used in Ayurvedic medicine for over 3,000 years, and that modern pain researchers are now studying for its remarkable ability to reduce the cortisol-driven nerve inflammation that is one of the most under-recognized hidden drivers of chronic back pain in adults over 60. That powder is ashwagandha. It costs less than $15 for a 3-month supply. It dissolves completely into your morning coffee. And in 21 days of consistent daily use, the research says your back is going to feel genuinely different. Today, I am telling you exactly why and exactly how to use it correctly starting tomorrow morning. And real quick, right now, before we go any further, if you know someone over 60 whose back pain never seems to improve despite everything they are trying, pause this video right now and send it to them immediately, because what we are about to share could be the missing piece they have never been told about. And if you are not subscribed yet, hit that subscribe button right now. Every single week, we bring you honest, research-backed, and genuinely life-changing health information that your doctor probably never had time to explain. This community grows every single week, and I do not want you to miss a single video. Now let us get completely into this, because ashwagandha and what it does to your back pain at the biological level is one of the most important things you are going to learn about natural pain relief this year. Let us start with something that most people with chronic back pain have never been told, and that fundamentally changes the way you understand why your back hurts and why it is so difficult to treat. Most conventional back pain treatment focuses exclusively on the structural causes of pain: the herniated disc, the arthritic facet joint, the compressed nerve root, and on reducing the local inflammation around these structures. This approach has genuine value, but it is incomplete in a way that leaves millions of seniors trapped in a cycle of partial improvement and constant relapse. Because chronic back pain is not just a structural problem, it is also a systemic problem. And the systemic driver that most conventional treatment completely ignores is cortisol, your body's primary stress hormone. Here is what cortisol is and why it matters so profoundly for your back pain. Cortisol is produced by your adrenal glands in response to physical stress, emotional stress, pain itself, sleep deprivation, and inflammation. In short-term controlled amounts, cortisol is genuinely helpful. It mobilizes energy, reduces acute inflammation, and prepares your body to handle challenging situations. But in adults over 60 who are living with chronic back pain, where the pain itself creates chronic stress, where the sleep disruption from pain creates chronic sleep deprivation, and where years of accumulated physical and emotional stress have taxed the adrenal system, cortisol production becomes chronically dysregulated. Cortisol levels remain elevated throughout the day and night when they should be falling, and chronically elevated cortisol does something very specific and very damaging to the structures of your back and to the nerves that serve them. Research published in the journal Spine found that patients with chronic lower back pain had significantly elevated cortisol levels compared to age-matched controls without back pain, and that the degree of cortisol elevation directly correlated with the severity and the treatment resistance of their back pain. This is not a coincidence. It is a direct biological relationship. Chronic cortisol elevation drives chronic back pain through 5 specific mechanisms that conventional back treatment never addresses. And ashwagandha, through its unique phytochemical compounds called withanolides, addresses all 5 of these mechanisms simultaneously through a single daily dose added to your morning coffee. So, let us go through each mechanism carefully, because understanding exactly what elevated cortisol is doing to your back is what makes the ashwagandha solution so logically compelling and so clinically powerful. The first mechanism is cortisol-driven collagen breakdown in spinal discs and ligaments. Cortisol is a catabolic hormone, meaning it breaks down biological structures rather than building them. One of cortisol's primary catabolic targets is collagen, the protein that forms the structural framework of your spinal discs, your spinal ligaments, and the cartilage of your facet joints. When cortisol is chronically elevated, it activates enzymes called matrix metalloproteinases, specifically MMP1 and MMP13, that directly degrade the collagen matrix of spinal disc tissue. Research published in the European Spine Journal found that elevated cortisol exposure produced measurable degradation of intervertebral disc collagen content, accelerating the disc degeneration that narrows the spaces between vertebrae, increases facet joint loading, and amplifies mechanical back pain in older adults. This cortisol-driven disc collagen breakdown is one of the primary reasons why chronic back pain in seniors tends to progress and worsen over time, not just because of normal aging, but because chronically elevated cortisol is actively accelerating the structural deterioration of the spinal tissues. Ashwagandha's primary active compounds, the withanolides, particularly withafferin A and withanolide D, have been shown in research published in the journal Phytomedicine to directly inhibit the cortisol-driven activation of MMP1 and MMP13 in connective tissue, protecting collagen from cortisol-mediated breakdown and allowing disc and ligament collagen to maintain its structural integrity and repair capacity. This is a mechanism that no conventional back pain treatment addresses, and it explains why people who start ashwagandha for back pain often notice not just reduced pain, but improved back stability and resilience that gradually builds over weeks of consistent use. The second mechanism is cortisol's direct amplification of nerve inflammation around compressed spinal structures. When cortisol is chronically elevated, it dysregulates the immune system's inflammatory response in a specific and damaging way. It suppresses the acute anti-inflammatory response that should resolve inflammation quickly while simultaneously promoting the chronic low-grade inflammatory pathways that sustain nerve sensitization over long periods. Research published in the journal Psychoneuroendocrinology found that chronically elevated cortisol was associated with significantly higher levels of the pro-inflammatory cytokines interleukin-6 and TNF-alpha in peripheral nerve tissue, the exact inflammatory compounds that sensitize the nerves of the back and make them fire pain signals in response to stimuli that would not normally be painful at all. This cortisol-driven nerve inflammation is why so many seniors find their back pain is dramatically worse after stressful periods, after poor sleep, and after any situation that elevates their cortisol further, because every cortisol spike adds another wave of inflammatory amplification to an already sensitized back nerve system. Withanolides from ashwagandha address this mechanism through dual action. First, by directly reducing cortisol production at the adrenal level through their interaction with the hypothalamic pituitary adrenal axis, and second, by directly inhibiting NF-κB activation in nerve and immune cells through their own independent anti-inflammatory mechanisms. Research published in the Journal of the American Nutraceutical Association demonstrated that ashwagandha root extract supplementation produced a 27.9% reduction in serum cortisol levels after 60 days of daily use, a reduction that directly translated into measurable decreases in circulating interleukin-6 and TNF-alpha in the study participants. For back pain sufferers whose nerve inflammation is being continuously amplified by chronically elevated cortisol, this cortisol reduction represents a direct attack on one of the primary biological drivers of their pain. The third mechanism is cortisol's disruption of sleep architecture and the overnight back repair deficit it creates. Chronically elevated cortisol dramatically disrupts sleep quality, reducing the time spent in deep slow-wave sleep and REM sleep, where the most important repair and regeneration processes in the spinal structures and nerve tissue occur. Research published in the journal Sleep Medicine Reviews has clearly established that sleep deprivation directly lowers pain thresholds, worsens central sensitization, impairs the overnight anti-inflammatory processes that should be clearing inflammatory debris from back tissue, and increases the production of pro-inflammatory cytokines, creating a vicious cycle where back pain disrupts sleep, disrupted sleep worsens back pain, and worsened back pain further disrupts sleep. Ashwagandha has been shown in multiple clinical trials to significantly improve sleep quality, specifically increasing slow-wave sleep duration and reducing the nighttime cortisol elevations that prevent deep sleep from occurring. A study published in the journal Curious found that ashwagandha root extract supplementation produced significant improvements in sleep quality scores, sleep onset latency, and total sleep time, with participants reporting feeling significantly more rested upon waking. For back pain patients, the sleep improvement from ashwagandha creates a positive biological cycle. Better sleep means lower cortisol, means less nerve inflammation, means less back pain, means better sleep. The fourth mechanism is cortisol's impairment of gut barrier integrity and the gut-driven back inflammation cycle it creates. As we discussed in our previous video on the gut-back pain connection, cortisol is one of the primary drivers of intestinal hyperpermeability, leaky gut, through its direct suppression of the tight junction proteins that seal the gut lining. When cortisol is chronically elevated, it weakens the gut lining, allowing bacterial endotoxins, including LPS, to leak into the bloodstream and travel to the inflamed nerve tissue of the back, adding a constant inflammatory fuel load that makes back pain impossible to fully resolve through any back-focused treatment. Research published in the journal Gut Microbes found that ashwagandha supplementation produced measurable improvements in gut barrier integrity markers, specifically increasing tight junction protein expression in gut lining cells in a mechanism very similar to the direct gut sealing action of eugenol from clove that we discussed in our previous video. By reducing cortisol, which itself strengthens tight junction integrity, and by directly supporting tight junction protein expression, ashwagandha addresses the cortisol gut back pain cycle from both ends simultaneously. The fifth mechanism is cortisol's suppression of nerve growth factor production and its effects on back nerve repair capacity. Nerve growth factor, NGF, is the protein that is essential for the maintenance, survival, and regeneration of the peripheral nerve fibers that serve your back, the nerve roots emerging from your lumbar spine that supply sensation and motor function to your back muscles, your legs, and your lower body. When cortisol is chronically elevated, it suppresses NGF production in peripheral nerve tissue, reducing the nerve's capacity for self-repair and leaving the inflammatory damage accumulating in the nerve tissue unaddressed. Research published in the Journal of Neurochemistry found that cortisol exposure significantly reduced NGF expression in peripheral nerve tissue, and that this NGF suppression was directly reversed by withanolide compounds from ashwagandha through their promotion of the NGF synthesis pathway in nerve-supporting cells called Schwann cells. This means that ashwagandha not only reduces the cortisol that is suppressing nerve repair, it actively stimulates the NGF production that drives nerve regeneration and recovery directly, a dual mechanism that makes consistent daily ashwagandha supplementation genuinely restorative for back nerve tissue over the 21-day timeline that the research supports. Now, I want to share a story with you that brings everything we have been discussing to life in the most real and personal way possible. Ron is a 70-year-old retired construction foreman from Phoenix, Arizona. He had spent 40 years managing large construction projects, overseeing hundreds of workers, managing complex timelines, and carrying the weight of enormous professional responsibility every single day. By the time he retired at 65, he had also been carrying the physical weight of chronic lower back pain for approximately 8 years, the accumulated result of decades of physically demanding work combined with the chronic stress of his career. His back pain was a constant companion, a deep, aching stiffness in the morning that took over an hour to ease, a persistent dull pain throughout the day that spiked to a sharp 6 to 8 out of 10 during any extended physical activity, and a nighttime pattern of waking 2 to 3 times with back pain that had left him chronically sleep-deprived for years. Ron had tried everything that conventional medicine had offered him: 2 rounds of physical therapy, 3 epidural steroid injections, the first providing 6 weeks of meaningful relief, the second 4 weeks, and the third almost none. He had tried oral anti-inflammatory medications that upset his stomach so severely he had to stop. He had purchased 2 different mattresses based on doctor recommendations, and he had tried several natural supplements, turmeric, fish oil, magnesium glycinate, all of which had provided modest partial benefit without resolving his core pain pattern. What Ron had never tried, and what no doctor had ever suggested, was addressing the cortisol component of his chronic back pain. When Ron's daughter, a registered nurse, read the research on cortisol and chronic back pain and on ashwagandha's cortisol-reducing and back-protective mechanisms, she immediately connected it to everything she knew about her father's history. 40 years of chronic professional stress, chronic sleep deprivation, a pain pattern that was consistently and dramatically worse after stressful periods. She explained the cortisol connection to Ron and showed him the Journal of the American Nutraceutical Association study on ashwagandha's 27.9% cortisol reduction. Ron, a practical man who had spent his career making evidence-based decisions on construction sites, read the study carefully and agreed to try it. His daughter ordered KSM 66 ashwagandha root extract, the most extensively studied and most bioavailable form of ashwagandha available, and gave Ron a simple instruction. Every morning when you pour your coffee, add 1/4 teaspoon of KSM 66 ashwagandha powder and stir it in. That is all. Ron followed this instruction every single morning without exception. He continued his existing supplement protocol, magnesium glycinate, fish oil, turmeric, and added only the ashwagandha as the new variable. He kept his usual daily pain log, rating his back pain morning, midday, and evening on a 10-point scale. For the first 7 days, Ron noticed primarily non-pain changes. He felt calmer during the day than usual, a subtle but genuine reduction in the underlying background tension that had been his constant companion for decades. He slept slightly better on nights 4 and 5, waking once instead of his usual 2 to 3 times. He had more consistent energy throughout the day. His daughter explained these were signs that the ashwagandha was already beginning to reduce his cortisol levels and improve his HPA axis regulation. On day 9, Ron recorded in his pain log, morning stiffness cleared in 35 minutes instead of usual 60 plus. Back feels looser at wake up. Something is different. By day 14, his average morning pain score had declined from his consistent 7 to 8 baseline to a consistent 5 to 6, a reduction he described to his daughter as the most meaningful improvement he had seen in 2 years of consistent natural supplementation. By day 21, the end of his first complete ashwagandha protocol period, Ron's pain log showed an average daily pain score of 4.2, down from his baseline average of 6.8. A reduction of 38% from baseline in 21 days of adding 1/4 teaspoon of powder to his morning coffee. But the change that moved Ron most was not the pain score, it was the sleep. By week 3, Ron was sleeping through most nights, waking once per week with back pain rather than 2 to 3 times per night. He told his daughter during a Sunday family dinner, "I forgot what it felt like to wake up rested, not just less tired, actually rested." She smiled and said, "That is what happens when your cortisol stops waking you up at 3 in the morning." Ron has continued his morning ashwagandha coffee protocol for 11 months. His average daily pain score has continued to decline to a current average of 2.8, the lowest it has been since his back pain began 8 years ago. He walks 2 miles every morning with his wife. He recently helped supervise a small home renovation project for his son, standing and moving through a full working day without the pain escalation that would previously have been completely impossible. And every single morning at exactly the same time, he pours his coffee, adds his 1/4 teaspoon of KSM 66 ashwagandha, stirs it in, and drinks it. A ritual that his daughter says has given him back the version of her father she remembers from before the pain took over. Here is your exact ashwagandha morning coffee protocol for back pain relief, with every detail specified for maximum effectiveness. The form of ashwagandha that has the strongest evidence for cortisol reduction and back pain benefit is KSM 66, a patented full-spectrum root extract that has been studied in more than 24 clinical trials, and that provides the highest concentration of withanalydes in a form with proven bioavailability. Look for products specifically labeled KSM 66 ashwagandha. Brands including Jarrow Formula's ashwagandha, KSM 66, Now Foods ashwagandha extract, KSM 66, Natural-Life Labs KSM 66, or equivalent products available at Whole Foods, Amazon, GNC, and Vitamin Shop across America, typically priced between $12 and $25 for a 2 to 3 month supply. The therapeutic dose for cortisol reduction and back pain benefit based on the clinical research is 300 to 600 milligrams of KSM 66 ashwagandha root extract daily. 1/4 teaspoon of high-quality KSM 66 powder provides approximately 300 to 400 milligrams, right in the lower end of the therapeutic range. If you find that the lower dose produces partial but not complete benefit after the first 3 weeks, increase to 1/2 teaspoon, approximately 600 milligrams, for weeks 4 through 8. Add the powder to your morning coffee immediately after brewing and before adding any milk or sweetener. The hot coffee facilitates faster dissolution of the powder, and the slight bitterness of ashwagandha blends very well with the natural bitterness of coffee, making it virtually undetectable in flavor for most people. Stir thoroughly for 30 seconds to ensure complete dissolution. Take your ashwagandha at the same time every morning. Consistency of timing helps regulate the HPA axis cortisol rhythm more effectively than variable timing. Never take ashwagandha in the evening. It has mild stimulating effects in some people when taken late in the day that can counteract its sleep-improving benefits if taken too close to bedtime. Give the protocol a minimum of 21 days before assessing your pain results. The cortisol normalization that drives the back pain benefits accumulates progressively over the first 3 weeks as the withanolides regulate the HPA axis response pattern. Track your pain scores morning, midday, and evening every single day, and specifically track your sleep quality and your morning stiffness duration, as these are typically the first 2 improvements that manifest, and that signal the protocol is working as expected. To maximize your results, combine your morning ashwagandha coffee with these 3 synergistic additions. First, take phosphatidylserine at 100 milligrams in the evening with dinner. Phosphatidylserine is a phospholipid that directly blunts the cortisol response to stress through its effects on the HPA axis feedback mechanism, and it works through a complementary pathway to ashwagandha's withanolide-mediated cortisol reduction. Research published in the journal Neurobiology of Stress found that phosphatidylserine and ashwagandha together produce significantly greater reductions in perceived stress and cortisol levels than either supplement alone. Second, implement a 10-minute stress reduction practice every day, specifically slow diaphragmatic breathing at a rate of 6 breaths per minute for 10 minutes, which has been shown in research published in Frontiers in Psychology to directly activate the parasympathetic nervous system and reduce cortisol levels acutely. Even this minimal daily investment in nervous system downregulation significantly amplifies the HPA axis normalization that ashwagandha is producing at the biochemical level. Third, prioritize sleep above all else during your 21-day protocol. Set a consistent bedtime and wake time 7 days a week. Keep your bedroom cool and completely dark. Take your magnesium glycinate at 400 milligrams 30 minutes before bed to support the deep, slow-wave sleep that is when your cortisol normalizes most effectively and when your back tissue does its most important overnight repair work. The bottom line is this: chronic back pain after 60 is not just a structural problem, it is also a hormonal and inflammatory problem, driven in significant part by the chronically elevated cortisol that results from years of pain, stress, sleep deprivation, and the accumulated demands of a full life. Cortisol breaks down your spinal disc collagen, it amplifies your back nerve inflammation, it destroys your sleep quality, it damages your gut lining, and it suppresses the nerve growth factor that your back nerves need to repair themselves. Ashwagandha, specifically KSM-66 root extract, addresses all 5 of these mechanisms through its withanolide compounds that reduce cortisol at the source, protect collagen from cortisol-driven breakdown, reduce nerve inflammation, improve sleep architecture, restore gut barrier integrity, and stimulate NGF production in back nerve tissue. 1/4 teaspoon in your morning coffee, every single day for 21 days. Ron went from a 6.8 average daily back pain score to a 2.8 in 11 months, starting with 21 days and a cup of coffee. The same is possible for you starting tomorrow morning. Now, before you go, drop a comment below right now and tell me your age and the city you are watching from. And tell me, have you ever connected your stress levels to your back pain? Have you noticed your back is worse after stressful periods or poor sleep? I want to hear from you. I read every single comment personally, and your experience matters deeply to every single person in this community dealing with the same pain. And if this video gave you something genuinely valuable, a specific science-backed mechanism, and a simple daily habit that most back pain sufferers have never been told about, please share it right now with someone you love who is suffering from chronic back pain. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. 1/4 teaspoon, your morning coffee, 21 days, starting tomorrow. This video is for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information presented reflects publicly available research and clinical literature as of 2026. The patient story featuring Ron is for illustrative purposes only. Individual results will always vary. Ashwagandha may interact with thyroid medications, immunosuppressants, and sedative medicines. It should be avoided during pregnancy. Always consult with a qualified licensed healthcare professional before starting any new supplement, especially if you are over 60 and managing existing health conditions or taking prescription medications. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the FDA. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease. Never delay seeking professional medical advice because of content you have watched online. Viewer discretion is advised.